moment. Good morning, everyone. My name is Annie Lindy Kugel. I use she, her pronouns, and I am the Executive Director of the Community Services Network. Today is our Tuesday monthly learning session. We have changed the name. So moving forward, we'll use that name to reference these Tuesday sessions, which happen once a month, every third Tuesday from 9:30 to 11. So welcome, it's great to have you here. Thank you so much. And thank you to our presenters who will share time and knowledge with us today. We're excited to learn from you. We did unfortunately have 2 cancellations this morning. So we will not be hearing from Mason with the Oregon Food Bank or Kaz with C3 Northeast PDX. I'm hoping to add them in the future, but just circumstances are not allowing them to attend this morning. So, but we do have Sherielyn with Milk Crate Kitchen, Enedina with the OHA Oregon Health Insurance Marketplace, and Sam Allen with Stone Soup PDX. So super excited to hear from all of them. And then after that, I do have some CSN updates for you. I have a lot going on right now, so I wanted to take a little time to share that with you as well. So any questions before we get started? Okay, awesome. Well, welcome. Our first presenter is Sherielyn with Milk Crate Kitchen. Sherielyn, are you on? There you are. Okay, I see you now. And I think you're muted. It automatically mutes you when you enter, so that in case people come in later and they don't want to interrupt the presenter. So welcome. Thank you so much for being here.
Good morning. Hi, Annie. Thank you. My video tends to slow down bandwidth, so I'm going to turn it off when I share my screen, if that's okay with everybody.
No problem.
Okay. How's everybody doing today? Sorry, I joined a little bit late. All right, I'm not going to be looking at my screen the entire time, so if people ask questions in the chat, I would appreciate maybe Annie helping me moderate that. Yeah,
you bet.
Call my attention. All right, okay. Hi, everyone. My name is Sherielyn Gardner. My pronouns are she, her, hers. I am the co-director of Milk Crate Kitchen. We are a 501c3 nonprofit, established as a nonprofit in April 2021, but was founded in April 2020 as a mutual aid, really a passion personal project by Michael Casper, just one person. And in essence, our mission is overcoming barriers to food security by cooking and delivering, actually, I should say distributing, because we also offer meal pickups in person now, cost-free meals to those in need. No cost to them, no questions asked. Let me see if I want to tailor my presentation. I know originally I was only going to have 5 minutes, but I understand we've had we've had some changes. So I'm really glad that there will now be a chance for people to ask questions. And so I am very passionate about what we do. I want to be mindful of time. So I know everybody's got their video. Most of the people have their videos off, but maybe just by reaction, show of thumbs up. How many of you have heard of us? Okay. Okay. That's not bad. 4 or 5 thumbs up, considering we've only been around for a couple of years. Like I said, we were a mutual aid. We still operate with a mutual aid perspective, but because we're mostly volunteer supported, and we were 100% volunteer run and volunteer supported between 2020 and February 2023, we didn't do a lot of outreach, so many people don't know about us. But I'm going to go ahead and share my screen. And hopefully I'm sharing the right screen here. Let's see. Can you see the website, milkcratekitchen.org?
Yes.
Okay, perfect. So we have a website. We are pretty decent at updating our website, but if you would like to know the latest updates about what we're up to, what new programs are we piloting, how are we increasing our reach, our capacity to provide a cooked meal to the tri-counties, Multnomah County, Washington County, and Clackamas County, I encourage you to go to our website. So when you go to, I encourage you to go to our Instagram page. So on our website, milkcratekitchen.org, we have, just who we are in essence. We feed families one cooked meal at a time. We are chef-led. Michael Casper is culinary trained. He went to Oregon Culinary Institute, and he has over 10 years of experience cooking for various food places here in Multnomah County. And with that knowledge, we are able to tailor the meals that we provide as much as possible within our means and our capacity. So what does that mean? Well, first off, how do we keep our food costs down? We do that by doing what's called food gleaning, otherwise known as food rescuing and food diverting. So wherever there is a surplus of food extras, not to say these are afterthought, poor quality, expired food, by no means, far from that. Remember when we had the heat wave when it was too hot to shop outside at the farmer's market. And so that's just an example of how businesses end up with extras. Portland is a food mecca. It's a foodie mecca. We have food carts everywhere, right? Well, if you've ever been to one of those food carts buying food, Portland, for some reason, it gets the hottest at 5 o'clock in the afternoon when the temperature peaks. And so food carts and food trucks usually end up with more food than they would like because they simply don't get a lot of customers. So that said, Casper being connected in the local food and restaurant scene, that gives us access to those businesses and connect with them in ways that allows us to receive in-kind donations of, a cooked rice or even raw ingredients. And we try to avoid major allergens. So right now our website needs some updating. And before I forget, I started by saying we do a better job of updating our Instagram page just because it's quicker. We're just a 2-person staff, Michael, Casper, and myself, and then the rest are volunteers. So down here, you'll see our mission statement that I said earlier. And then here, there are links to, and I encourage you, if this is your first time hearing about our organization, I encourage you to explore a link tree. It has links to media and stuff. We've been on interview with radio stations as well as podcasts, and then KOIN. Anyway, I'll come back to this. Down here, you'll also find links to our social media, Facebook and Instagram. You'll see the same information on Facebook as you see on Instagram. So, back to what I was saying, where we avoid major allergens. What we do differently than other soup kitchens or other nonprofits that do equally amazing job of ensuring that less people go to bed hungry, that we do what we can to reduce hunger and food insecurity that, already marginalized communities, not just in Portland, not just in Multnomah County, but also in the Tri-Counties experience. We turn those whole ingredients, just like what you see here, lentils, and we cook with that. So what we do is we write our menu. It used to be every Monday morning. Now it's every Tuesday. We write the menu for the week, and then we always have a meat-based and a plant-based protein for our vegan and vegetarian friends. Our family meal component, or our family meal, is our flagship program. We started out in the pandemic when a lot of restaurants and food establishments, even food pantries, either had to close entirely until they figured out how to safely reopen back to the public. Restaurants did the same thing. They had to scale down from like dine in to takeout only. And to sustain their business model, they had to pivot and do what's called pre-ordering. And cost-wise, it was more effective for a lot of these food carts, food restaurants, as well as food trucks, as well as restaurants, to provide what's called a family meal style. And so that said, when you go to our website under request a meal, we're actually on break this week. I'll come back to that later. But we do our best to over communicate. Why? Because the families we serve families and individuals that we serve come from diverse socio and economic backgrounds. We have folks with intellectual development disability. We have people who identify as having physical disability. We have folks that are blind, people that are deaf. And so they actually lean on others to help them, whether that's a caregiver, a service provider, a neighbor, a colleague, or just a friend, right? So we are highly impacted, unfortunately. I wouldn't say it's a good problem to have at all. If you look at the timestamp here, we now changed when we post our menu, which is every Tuesday morning. So this is from a week ago. It started out without this closed banner. So we made grandma's tomato gravy with or without ground meat, with pasta noodles and vegetables. DF stands for dairy-free, SF is soy-free, glutinous, everybody know. I mentioned that our flagship program is the family meal. So one meal feeds up to 4 portions. Again, people who are requesting our meals, there is no cost to them. When we say no questions, what we mean by that is there is no barrier. There's no entry requirements. We don't need proof of ID. We don't need proof of income. We just don't need to know why you're asking for help, simply put. So we open up our menu on Tuesday morning. So I'm not going to go bullet point here, but I do want to draw attention to that. We spend a lot of time being intentional about how we wrote this. I mentioned that people come from diverse background and experiences. We have folks that come to us that have been traumatized over and over again by systems and agencies that they trusted and have failed them. So Milk Crate Kitchen, what we do, we're based on rapport, building trust, and cultivating partnerships, intentional partnerships with community members. And so that said, when we finally get somebody to come check us out and learn about our process of when we post a new menu, how do people find out about it? Well, people share about it on social media, except we're on break. We utilize a platform called Smartsheet. It's basically a glorified Google Sheet, but it's got a robust and more dynamic features. We open it on a Tuesday morning. We tell people when they can expect to sign up. Unfortunately, it doesn't take long. The moment we open our form on Tuesday, it takes about 2 to 3 hours at most for it to fill up. So imagine a soup kitchen with 80 individuals, some of those with children, some of those on wheelchair, signing up in a matter of 2 to 3 hours each week that we're in service. We don't limit how frequent people can request for a meal, but we do limit 1 family per household, aka 1 request per address. Speaking of address, does that mean we don't serve unsheltered, houseless community? With the flagship family meal program, the answer is simply yes. Why? Because we offer delivery, and then for that to happen, we need a stable address. However, later I will speak about a program we piloted in the summer where we are able to creatively create meals that are individually portioned or in bulk. And we are able to put that in community fridges and roll in nonprofit organizations that need food but don't have budget for it. That's how we're touching up on helping the unsheltered neighbors. So 1 family meal per address, and then just the process, right? So this part here is as good as it gets until we can get funding, until we can get more volunteers that are more savvy with website updating. So yeah, this is the menu. We want people to know what they can expect. Why? Because we do food rescue. We spend hours on our personal time and on our weekend finding these food extras, diverting them from going to waste. You know, many of you might have heard of Lardo, the sandwich shop. They have several locations, and they would hit us up and say, hey, how do you feel about 80 pounds of mortadella? Hey, how do you feel about 200 very pink hamburger buns? You know, we say yes. And so part of what we've been doing this summer is finding more space that has a cooler, you know, a walk-in refrigeration freezer that we can access 24/7, because food donations, they come with little notice sometimes, especially when we're dealing with extreme climate conditions like the snowstorm in the winter or in the summer when we hit 95+ degrees. As you can imagine, nonprofits are already stretched thin. And so unfortunately, many of them, don't work on weekends. We actually work on Saturdays and Sundays. B, they can't just move and drop what they're doing and drive 30 minutes to go one place to pick up like 200 bags of bread, right? We do what we can with what we have. And so that said, we care about minimizing food waste. So if we're taking these ingredients and turning them into a cooked meal, and then people sign up for it, we want to make sure that it gets consumed, because our mission is only as good as that. If it doesn't go to the finish line, then it's not helping them, which is why we also are very transparent. Hey, it's unfortunately this week it's not gluten-free. Unfortunately this week it has nuts, but we're all about empowering folks, and that means giving them options. We've heard many times feedback about other food providers, and they get criticized about their work, which is kind of a sad thing, right? Because we're all doing what we can. But I also understand where the individual is coming from, because if they already have health issues that prevent them from eating foods that have anti-inflammatory or that are high in calories, high in sodium, highly processed. Let's talk about the food deserts. Those are all things we thought about when we crafted our mission statement. And those are all things, components that we still think about as we seek funding, as we seek new partnerships. But in the essence, that's what we do. I have a lot more things that I can share with you all, but I feel like this is a good time maybe to pause for questions. If anybody have any. I enjoy more of a fluid conversation than me speaking for like more than 5 minutes straight.
Yes, there was a couple, let's see, from Caitlin. This is amazing. Do you find that you reach maximum capacity each week?
Yeah. And again, I'm not looking at everybody. So thank you for that question. We do. So I couldn't get on the dashboard that we use, the smart sheet, but yes, it is. It's sad. The moment we post the menu, first off, by the time I finish updating all the things, I start by updating our Wix. We use Wix for our website platform. And then I create the Canvas slide, which is what produced that menu board that you saw earlier, this one. I then write my caption and then I post on social media. I guarantee you that by the time I look at Smartsheet, which is our intake form, they're already email. So first off, the Smartsheet form doesn't turn on until our website is updated, because it's important that for us that people at least get to see what they can expect to receive later in the week. We don't deliver till Saturday. So what happens is people already message us on Facebook, Instagram, they email us, they go on our website under contact where you can also reach us. And it's the same question. Hey, I was on your website. I didn't see a menu. Are you guys open today? And then I post the menu and I turn on the request form. And within 30 minutes, there's 30 names on the list. So yes, that's a long answer to saying yes.
Yeah, so I see June wanted to know, it said, I see that one meal feeds 4, but what if they need more?
Yeah, again, a good question. In the past, when Casper started this, he was actually allowing 2 meals for those households that have several individuals. Something happened in May 2021 where somebody shared about us in a Buy Nothing Facebook group, and so we blew up. We went from providing to 40 households an average per week to 130. So that means we had to triple recruiting volunteers, triple sourcing food ingredients. We're very bad at fundraising at the time. We didn't know how to write grants. So it was kind of a scramble. But one thing we did is we met the challenge. Somehow we did it, and we allowed to deliver 120 family meals. And at that time, we were allowing 1 to 2 requests. We didn't ask how many households were in the family in that address. But then it kind of got a little out of hand, and more people were coming to us saying, I can't get on your list. I've been trying for 5 times. So then, to be as equitable as possible, we changed our process to allow just 1 per address or 1 per household. What happens now, June, is when somebody does need more than 1, on the intake form, let me see if I can get in. Yeah, it's going to be problematic. So we use Smartsheet. So when people go and request a meal, there is a button, which actually I'm going to go ahead and do it. So because our online meal request form is turned off right now, and we don't want to get in the business of creating a wait list, But it is important to us to collect feedback from those people that have been trying and can't get on, or maybe it's been a long time since they received a meal. We want to understand the current and relevant state of things, the unmet need for accessible and affordable meals. So we created what's called an interest list. So when you click on this, it takes you to Smart Sheet. And here we say, I think it's here, I hope it's here. Again, some people bookmark this page. So because of that, we copy the same information that you find on our website, that you find on our social media, and we put that here as well. I want to think that somewhere here we say that if you need more than one, you can reach out to us, or if you have any questions, you can reach out to us. And that actually works because we have families that when they sign up for our meal request form, at the end, one of the optional questions is comments. And more than half of the folks that sign up for our meal fill out that comments box. And that's how we get more information about each individual or each family. And so that's where they would put something like, hi, I'm a household of 8. If you happen to have any extras, please think about us. And you know, this is temporary. We are working a lot behind the scenes, even though we're on service break this week, which means we're not cooking on Thursday and Friday. We're not distributing meals on Saturday for the flagship programs. We are doing something else, which is the pilot program I mentioned earlier. It's called CHOP. We're also continuing to write grants. We're continuing to do outreach. You know, I'm in a lot of meetings because I'm trying to get the word out there about who we are, what we do, and how we partner with other community-based organizations like Community for Positive Aging. We recently met with Urban Gleaners. I see Cassandra here from Lift Urban Portland. Love them. We're partners in crime. We've received a lot of food donations from them. And so what that does is hopefully it brings us more resources in. One thing that we're challenged with, the reason we have a limit of 80 per week and why we're only able to cook once or twice a week is because we don't have our own commercial kitchen. The volume that we provide is very high. So church kitchens usually don't have what we need. But if anybody here knows of a commercial kitchen that has a tilt skillet, has the proper hood, double ovens, 2 of them, basically the capacity and the space for MCK to produce 500 to 800 meals in 8 hours, please let us know, because that is why we have not been able to increase our capacity, and we don't want to increase it and not be able to meet the demand, right? Like we already are still in inflation. We're still dealing with the high cost of living. And so we want to do this in a way that we can maintain and sustain. Great questions.
Awesome. Thank you so much, Sherielyn. I have a couple more questions here. From Chloe, is there a time that the sign up posts on Tuesdays?
Yeah, sorry. Yes, but it's an open window. It's basically in the morning. What we do is we do our best to have it posted by 11 in the morning. So the reason it's not specific is because, again, we're still so small as a staff. We glean, which means at any time donations can come in and change and vary. And we really want to utilize that in our menu planning as much as possible. But honestly, it comes down to bandwidth. You know, you've got 2 part-time people, and we do what we can with what we have. Once we have a staff, so we're also hoping to employ more people, then we can move towards a more, structured, more formal way of, menu can be scheduled ahead of time. We use Meta for Facebook and Instagram. It does have a capability to schedule a post, but that is not a challenge. The challenge is, okay, I remember for context, in the last 6 weeks, we moved 4 times. It's a lot of work. It's a lot of work. So I don't say that to be, kind of defensive, but just understanding what goes on and how we're able to do what we've been able to do, which is not just provide, here's of frozen meal or canned food. Again, not bad things, but many people know what it's like to meal prep and to cook. And so to be able to do what we do, it takes a village. It takes a lot of time, it takes intention, it takes planning. And unfortunately, there have been a lot of curveballs thrown at us as a community, and then also in Milk Crate Kitchen. So You can rely though that before 12 o'clock on a Tuesday, our menu will be up. In fact, when you look at like this is just an example of our volunteers processing vegetables. We receive anywhere from 200 to 300 pounds of kale like that, spinach, and we do it by hand. This is our former kitchen, Para Todos, in Northeast Portland in Sullivan's Gulch, Hollywood District. And then we package them up, which is what you see here. Yeah, that big pot to make sauce.
Oh, this is amazing. Thank you so much.
Yeah.
Okay, a couple more questions, and then any further questions we'll have to save till the end until everyone has a chance to present. But this is such amazing work, Sherielyn. You should feel very proud about what you and you're both accomplishing. It's a lot.
Thank you. I'm going to stop sharing my screen.
Okay, and I'm just going to go back here. A couple other. Let me see what Okay, this is a great initiative. This is Saoni. Do you accept any food donations from regular households as well, or just
Yes.
commercial?
Yeah, great question. We do. Actually, yesterday I met, it's really cool because Amy is a comedian and she's part of a local comedy club. They did a fundraiser for us in December, and then they became an urban farm as a business. So they harvested beautiful rainbow shards yesterday and dropped it off at our kitchen. So of course, the volume that comes from community gardens as well as, home gardens are smaller, but fear not. We use it for that pilot program I called MCK Chopped. I know I said I'm going to stop sharing, but I'm going to share it real quick, Annie, if that's okay.
No problem.
Yeah, hop onto Instagram, look at Milk Crate Kitchen PDX, and then I actually pinned it where it says MCK Chopped Community Meals. Basically what we do is we added another night in the kitchen. The reason we cook at night is because our chef, our culinary director, has another part-time kitchen manager job at another nonprofit. So he's got his 8 to 5 job. That's the one that pays the bills. This is the passion project. I love Chopped because we utilize, first off, it's inspired from the Food Network show Chopped. And so we utilize 90 to 100% donated ingredients from individuals as well as businesses, farmers market. And then we use our creative muscles to put together a full meal that has starch, meat, and vegetables. And we package them out either individually if they're going to the community-free fridges, or we roll in a nonprofit organization, a different one every week. And then they can receive hotel pan styles of food. So some nonprofits like PDX Saints Love, they do a lot of wellness events all over Portland. They actually like it when people stay. So instead of giving them food in a to-go box, they like receiving it in pans, and then they serve it hot. And so Chopped has allowed us to, with a very small budget, with majority of our expenses really going towards packaging supplies, because that's expensive. We utilize what's available in kind donation of food. We put them in a cooked meal. We think about people that don't have teeth. We think about people that don't have the means to access a microwave and oven. So even chicken breast, we slice it up. We make softer meats, right? Because we want this to get consumed. That's the whole point. We want to nourish the community in a way that is that works for them. Yeah. So I hope that answers your question.
Yes, awesome. Thank you so much, Sherielyn. Thank you for all this information and for all the work that you do. There are a few more questions in the chat, but I'm going to see if you wouldn't mind going in and answering those, or we can save them to the end, whatever works best for you, Sherielyn.
Okay, yeah, let me look at that. Sorry, I was like, oh, 13. Okay, here we go. Where do we start? Did you find it usually? Okay, you're ready. Is it one meal per household? Yes. However, as you know, in Portland, there are a lot of those dwellings that have, like from the outside, it's one address, but it's actually like 1836 ABC. That counts as its own address. So as long as people are being very good at providing their address clearly, then it's not technically one meal per address, right? Or I guess per house. I see that one meal feeds 4. What if they need more? We answer that. Is there a time? Yeah. Getting another chef help you meet those needs. What would help you? Yes, please. If you are a seasoned home cook or you are a trained cook, we want to talk to you. please send us an email or hop on our website, fill out the contact form. Full disclosure, we have not received a lot of funding, and so it's going to be a volunteer-based position. That said, actually, I see Sam here from Stone Soup, but there are great agencies out there. Some of them is through Department of Human Services. It's called Workforce Development, that partners with organizations like us that are still micro and small. So together we can find ways to employ people and pay them a decent salary for apprenticeship. What are your goals for the future? Are you hoping to expand? Yes, absolutely. I wrote a grant for $200,000 with Trillium, biggest grant I've ever written. Almost gave me a heart attack. Needed 1 week to recover from it because I made it with 3 minutes left on the time. What is it about? It is the vision of MCK, and I'm calling it Project ABC. It stands for A Better Community Food as Medicine Meal Program. I'm super excited about it. If Trillium doesn't fund it, it's their loss. I now have a template I will take with me to go after capital funding and all that. Again, we're a small staff, so we're not trying to be aggressive with our approaches, but our plans is to stick around. You know, we always say, Casper and I, we're going to quit when the community stops employing us. That means people stop showing up to volunteer, individuals stop donating, businesses stop donating. There are a lot more questions left. I want to be respectful of time. Annie, is it okay if I come back to it later, or I can always answer it via email?
That would be great. Or you can even hit reply on the in the chat underneath each question and just answer it in the chat as well.
I'll do that. Thank you.
Okay, thank you so much, Sherielyn. Thank you for all you do. And I will send good vibes out into the world for your Trillium grant.
Thanks, Annie.
All right, thanks for being here. Okay, next up we have Enedina LopezPaz with the Oregon Health Insurance Marketplace. Welcome.
Thank you, Annie. Can everyone see my screen?
Yes.
Awesome.
And I can help monitor the chat for you.
Awesome. Thank you. So, hi, everyone. Once again, I'll just keep my screen open for the interest so everybody can see me. Good morning, everyone, and great info that was shared. That was amazing and really great to learn. So thank you for that. So what I'm going to talk about is what is the marketplace. My name is Enedina LopezPaz, and I'm an outreach and education coordinator for the Oregon Health Insurance Marketplace. My regions are Multnomah, Washington, and Columbia County. So yeah, so I'll get started on this. So who we are. Let's see. Okay, so who we are. The Oregon Health Insurance Marketplace is part of the state government that uses healthcare.gov for applications for financial assistance and enrollment into a health plan. We have our program team that oversees everything we do, and our outreach team, which is what I am part of, and we educate Oregonians across the state about their options through the marketplace. So what we do, once again, we make sure the plans sold on or to Oregonians meet the requirements set forth by the Affordable Care Act law. We also provide assistance with enrollments as well as educate Oregonians about financial health coverage options. So then you can see, we do outreach to the community as well. We attend community events, networking events, all sorts of stuff. So we're out there constantly sharing with the community all the resources that they can have when it comes to having health insurance here in our state. So what we do, we assist Oregonians by answering questions they may have regarding their health coverage and refer out to other agencies when necessary. For example, when someone is eligible for the Oregon Health Plan, we refer them to the Oregon OHP or Oregon Health Plan Assisters. And when people run into issues with healthcare.gov, we provide assistance to resolve those issues. So we advocate on behalf of the consumers when they have issues through their application on healthcare.gov. So health coverage in Oregon, there are different types of health coverage in Oregon, but our core focus is assisting people that use healthcare.gov. So as you can see on the screen, there's different types like Medicare for people 65 years of age and older, and under 65 if they have disability for 24 months or have end-stage renal disease, and once again, the Oregon Health Plan, which is the Medicaid here in Oregon. And we have small group plans and also individual plans, which can be purchased directly through insurance companies. But if it is purchased through healthcare.gov, that is where the consumers receive financial assistance. And that is, once again, our core focus. And individuals, once again, individual plans can be purchased through insurance companies or healthcare.gov. But as I mentioned previously, financial assistance is only available through healthcare.gov. So plans can be purchased directly through the insurance company, through healthcare.gov. And the sign-up time is our open enrollment is coming up, which is the same time every year, November 1st, 2023 to January 15th of 2024 for health coverage, which will start next year. So how this works, so if anybody enrolls through November 1st all the way through December 15th, their coverage will begin January 1st. But if they enroll after December 15, between December 16th and January 15th, their coverage will start February 1st. So there is that discrepancy or difference. So depending on if they enroll before December 15th, coverage starts January 1st. If they enroll after December 15, then their coverage will start February 1st. And it is the only time most people can get coverage, likely with financial help if they don't get health insurance through a job or a public program, once again, such as Oregon Health Plan or Medicare. And if eligible, people can enroll in the Oregon Health Plan at any time. So the Marketplace open enrollment period does not apply to OHP. OHP is open year round. You can apply for Oregon Health Plan any time of the year, but for Marketplace, there is a certain time when it's open enrollment. And also within 60 days of a qualifying life event. So a qualifying life event can be getting married, having a baby, losing other health coverage like Oregon Health Plan, or moving. So that qualifies someone to shop on the Marketplace and have health coverage. So that is our qualifying life event. So anytime they have 60 days to shop for coverage on the Marketplace if they have a qualifying life event. And who is eligible to shop on healthcare.gov? So people who live in the United States, in a state that uses healthcare.gov. For instance, Washington and California, they have their own state-based insurance marketplace, so they don't use healthcare.gov. We in Oregon, we use healthcare.gov, but hopefully soon, pretty soon, we will be having our own state-based insurance, so Oregonians will be shopping directly through Oregon. So that is something that it's in the work, and which might happen in open enrollment period, either 2026 or 2027. So that is something that we're pretty excited about here at the Oregon Health Insurance Marketplace. And also not be incarcerated unless not yet convicted. And they must have an eligible immigration status or be a US citizens. All immigration status qualify except for deferred action for childhood arrivals, which stands for DACA. But there is currently a proposed rule to expand eligibility for Marketplace health coverage to DACA recipients. So that is something that's in the talk. And once again, we're excited for that. Hopefully that does happen. And then DACA recipients who aren't eligible for the Oregon Health Plan or don't have coverage through their employer are eligible to shop on the Marketplace. So more to come on that once we get the final answers or the news regarding it. So financial assistance is premium tax credit, which help lower the amount a person pays for their health insurance, and cost sharing reductions, which help lower the cost a person pays for services and other out-of-pocket costs like insurance and deductibles. Cost sharing reductions are only available on silver plans, and the premium is the monthly cost to have health coverage. So we think of it as rent. It may change from one year to the next, but it stays the same month to month. So in order for Marketplace coverage to be active, consumers must pay their first premium on time. And once they enroll into a insurance plan, they will receive a bill from the insurance company within a few weeks of enrolling, and consumers can choose to pay either online, over the phone, or set up auto payments. So those are the options that usually insurance carriers offer. So that is how consumers can pay for their monthly premiums, which is monthly. And really quickly, I just wanted to bring up our income eligibility chart. So Oregon Health Plan versus the marketplace. So looking at the chart, you can see how the Oregon Health Plan levels work. And on the, we call this our federal poverty level chart. So for children 0 to 18 to qualify for the Oregon Health Plan, they can be up to 305% of the FPL chart. And for pregnant adults, 190%. For adults 19 to 64, up to 138% of the federal poverty chart. And also new this year, I don't know if many of you guys on the call are aware, but starting July 1st of this year, people are eligible for Oregon Health Plan, regardless of their immigration status, but also other criteria still do apply. And one of the biggest one is income. Oregon Health Plan is based on income. So just, so yes, it's great that their immigration status doesn't stop them from getting full coverage, but still their income does play a big role, whether they're eligible for Oregon Health Plan or not. So we just wanted to bring that up. And also, we do have provisions for Native Americans. So who does the marketplace consider a tribal member? So they're enrolled members of a federally recognized tribe, band, or pueblo, shareholders of Alaska Natives. And also they have cost protection, so no out-of-pocket costs for tribal members in households at or below 300% of the federal poverty level. They get reduced out-of-pocket costs for tribal members at any income level. And the good thing is that American natives or Alaska natives, they can enroll in a private health plan any time of the year and can change plans up to once a month. So they don't need to have a special enrollment period to change that. They can, if they want to change a plan, they're not happy with the plan that they have, they can totally do that once a month. So for them, it's different versus those who are not Native Americans or Alaska natives. So that is the great thing for our Native members. So when to refer to the marketplace. So you can refer, or consumers can refer to the marketplace when they don't know their insurance options, they need local assistance, they encounter, once again, barriers with healthcare.gov. So we at the marketplace, we can advocate on their behalf. And also groups as yourselves, if you guys would like to learn more or you would like us to present to your organization, you can reach out to us and then we can give insurance info sessions to either your organization or the communities, the people that you serve in your communities. We can definitely do that here at the marketplace and get help enrolling in coverage. So that is our website, or the link, oregonhealthcare.gov/get help, where you can go in. As you can see, you can add in a zip code, select what type of assistance you're looking for, either Oregon Health Plan, Medicare, Marketplace, SHIVA, which is a senior health insurance. I forgot the acronyms, but basically SHIVA is a great program for those on Medicare or who need guidance. So SHIVA is, once again, those programs are at no cost to the consumers and they are great service. So you can find a SHIVA counselor. Also, if you have a small business and you want information about insurance options, you can select the small business, and also the language. We have different languages that you can select, and also the specific county and the distance. So all of that can be done using our Find Local Help. So it's not just only for finding an insurance agent regarding private insurance, because once again, you can get assistance from Oregon Health Plan, looking for an assister in the community who can assist someone with Medicaid. And also it will pop up the different agents or community partners that are located in that area, as you can see on the map. So that is pretty cool tool that we do have at our oregonhealthcare.gov website. And key facts, once again, the marketplace is open for enrollment from November 1st to January 15. If you miss open enrollment, you may be able to enroll or change a plan. If you experience a qualifying life event, except for Native Americans, they can enroll or change a plan once a month. And nearly 80% of Oregonians enrolling through the marketplace qualify for financial help. And Once again, immigration status is no longer considered for Oregon Health Plan eligibility, but Oregonians must still be lawfully present to qualify for marketplace coverage, excluding DACA. Will stay tuned. Hopefully things do change, and then DACA recipients might be eligible to shop on healthcare.gov in the near future. And also free local assistance is available on our website at oregonhealthcare.gov. And you can reach us by phone. That is our customer service toll-free contact number, open Monday to Friday, 8 a.m. to 5 p.m. and also by email, and also on our website, healthcare.gov, or our Spanish. We do have our Spanish website, Cuidado de Salud. So those are the two other ways where Oregonians can reach us or find information. And I don't know if I can share our website really quickly. I want to point something out. Can you all see my
Yes.
the website? Okay,
Mhm.
awesome. So maybe it makes a little more sense. So here is our Find Local help link that I was showing. So you just enter the zip code, and then it'll find whether you're looking for marketplace, Oregon Health Plan, and it will populate uh, that information. So you click on search for help. So if in any of your organizations, you have someone who's like, I need help with Medicaid, and you say, oh, well, I know of this resource, OregonHealthcare.gov. We can go in and I can find you an assister in your area. So see, it brings down all the local agents, assisters, clinics who assist with Oregon Health Plans. They would have a P if they assist with the Oregon Health Plan, or an A for Medicare, I for Marketplace. And also another great tool that I just want to point out is our Get Started. So if somebody just wants to have an estimate of what they might get, so you would enter the zip code, the county, which has to be the exact county. That way the plans are specific to that county. So you just enter simple information, nothing that is personal. And then if you have a spouse, if you have domestic partner, dependents, so somebody can enter that, and they can just get a estimate of what they could potentially earn, of the assistance that they can get on the marketplace. So for this one, it says good news. That's how much you will receive in premium assistance. And also this household qualifies for cost share reduction. So all of that information is provided here. And when we click on next, you can choose your doctors if you have doctors that you're currently seeing, hospital, prescription. So all of that, it will display it on our window shopping tool. So that is a great tool for anybody who is just curious to know, well, I'm about to I'm gonna lose my insurance through my job. I want to see what options I got. So anybody can use our tool. They can visit our website and get a quick overview of what they could potentially be eligible for. And when they're ready, if they rather get an assistance from an agent, they can definitely search for help in our Find Local Help tool. And then there's a whole bunch of agents locally in that area who can assist with the marketplace. And once again, all the assistance from agents, community partners on our website is at no cost to the consumer. So that is a great thing. So that is the last thing that I wanted to share. So I don't know if anybody has any questions. Thank you.
Awesome. Thank you so much, Enedina. That was, there's some new features on the website that I haven't seen before. I really, really like that. Definitely a good tool to use. Okay, so, oh, Sherielyn was just commenting that what you said about I'm afraid I'll lose my benefits because I may be overqualified comes up so many times. Good to know about that comparison tool. Yes, I would agree, Sherielyn. That is definitely a comment that I hear so often, and it's definitely why the health insurance marketplace is so important to know about. A lot of us know about OHP, but kind of forget about the subsidies that the health insurance marketplace provides. So thank you so much, Enedina, and thank you for the work that you're doing. It looks like Julie posted Medicare open enrollment is earlier and active now, October 15th to December 7th. Seniors who need help with Medicare plans can get help with the SHIBA program at ADRC. So you can click there. Thank you so much, Julie. All right, any other questions for Enedina before we move along? Okay, and then Enedina, if you could put, if you don't mind putting your email in the chat, that way folks can connect with you with any questions afterwards. Great. Okay, awesome. And next up we have Sam Allen with Stone Soup. Welcome. Good to see you. Thanks so much for being here.
Hello, thank you for having me. Hello, everybody. Sam from Stone Soup. I have no PowerPoint presentation, just all the information floating around in my head. So bear with me as I send it all off to you. Stone Soup PDX is a 12-week culinary program. We have pretty broad boundaries for who we serve. We really just say anybody who's experiencing barriers to employment, which who isn't these days. But yeah, it's a 12-week Monday through Friday culinary program that at its core is intended to train people with the culinary skills to get entry-level positions in restaurants or other kitchens. But we also recognize that with as much food insecurity there is right now, culinary skills are invaluable for a multitude of reasons. So while we do design our program to give people introductory skills so that they can work in kitchens, we also build a lot of our programming around how to shop economically, how to preserve your food for the long term, how to cook for large groups of people, so that these skills can be useful in ways that are above and beyond just what somebody can use in a professional environment. We pay folks to be in our program. We recognize that 5 days a week for 12 weeks is a really big commitment for a lot of folks. So we have 2 different stipend options that folks can access. One is just a flat $2,500 stipend that comes in $500 checks starting in week 4. That has, no attachments to, like I usually say, no daddy government involvement. There's no tax money being pulled from it. So a lot of the folks who come to us are receiving benefits and have limits on how much they can make, and the stipend money will not affect any of that. For folks who don't have those kinds of barriers, we do have a partnership with WorkSource. So it takes a little bit more legwork, but folks can sign up through WorkSource to receive a stipend from them. It's actually an hourly payment of $17 an hour to be enrolled in our program. And if they complete all 300 hours, which our program tends to fit nicely into, it pays out at $5,000. So over the course of 3 months, that can be a pretty impactful amount of money as folks are trying to get back on their feet, or maybe even just make a switch into a new field and are interested in working in kitchens. This can be a great segue. A couple of things, we try to keep ourselves very low barrier, but we do have just a few barriers to entry for our program. Being 18 years old is one of them. Right now, we only have English speaking classes. We do have instructors who are Spanish speaking and are looking to hopefully in the future be able to provide some classes that are Spanish speaking. But right now, just English speaking. And then we do have the barrier that folks need to have some sort of form of stable housing when they enter the program, which can include shelter or doubling up. But right now, we're not actively working with folks who are actively living on the streets. 12 weeks, 5 days a week, we found was just too big of a commitment for folks to be able to sustain themselves while dealing with housing insecurity. So we are, not to say that we have not had folks who have lost housing or who have had to transition during that time. And we absolutely support them the best we can. We don't just remove somebody because they lost their housing while they were in our program, but we tend to only accept folks who have some form of stable housing. But really, that's it. Those are the only barriers of entry into our program. Let's see, what else can I say? Well, once folks get in our program, we do provide a few other things in addition to the culinary training. We can provide hot passes that are paid for the entirety of their time with us and up to a month after they leave the program. We pay for them to get their food handlers cards, and in the second week of the program, we can purchase non-slip shoes and work pants for the folks who are in our program. New cohorts start every 6 weeks. But I do want to state right now, if you have people that are interested in joining our program, we have built up a pretty hefty wait list. And on average, it really depends on where people are at when I reach out to them. But right now, I think the average wait time is about 3 months from when somebody signs up on our wait list to when I'm reaching out to them to start with one of our cohorts. So it is a good thing to let your folks know that it won't be right away. Some people end up waiting even longer than that 3-month period. So it can be a really good thing if somebody is at a transition point and, they're still working on getting a few things in place. I totally encourage them to sign up now, because the likelihood that they'll be in a different place by the time I'm reaching out to them could be very real. I'm also pretty flexible. If I reach out to somebody and they're like, "Oh, I can't join this cohort right now," I'm happy to hold them on my wait list and reach out to them in 6 weeks when the next cohort is starting. So it's not this sort of like, "Oh, it was your time and you missed it, and I'm booting you off the wait list." I try to be pretty flexible, recognizing that who knows where they're going to be in 3 months sometimes. What else? We are in a little bit of a pivot point right now. We are hopefully absorbing a second kitchen. We do run 2 social ventures that do things like catering, making contract meals, and we have a retail soup line that's sold in Zupans right now. And the needs of our social ventures have outgrown the space that we're in that also holds our program space. So we're very hopeful that we will be absorbing another kitchen soon, which will mean that our program will have the entire space that we're operating out of right now. Once that happens, I'll be able to increase the number of our class sizes, and even potentially increase the hours that the classes are. Currently, the first 6 weeks, folks are from 9 a.m. to noon, which is pretty short to try to get instruction in. And the second 6 weeks is from 11 a.m. to usually 4 to 5 p.m., depending on how quickly we boogie through our projects that day. But we're very hopeful that once we are able to expand the program within this space, we'll be able to increase the hours of the program itself and increase the amount of folks that we're taking on, and hopefully shorten that wait list so that people aren't having to wait so long to join us. Okay, I rapid fired a whole bunch of information off there. I'm happy to take some questions about the program.
Thank you so much, Sam. And good to see you again. I love
I
seeing
know,
people pop
long
up
time
in
no
different
see.
spaces. Okay, so couple questions I think that I see. One was talking about, Vanessa, I don't know if that was for Sam or Enedina, but I'm sure people will want your information too, Sam. So if you wouldn't mind sharing that in the chat as well.
Oh, and if sorry,
Yep,
can I
go ahead.
interject a thing I remembered to say of
Yep.
how you actually sign up for our program?
Yes.
As I imagine is probably one of the questions, is that if you go to our website, stonesouppdx.com, right now, we've limited like the only path for getting on the wait list, because we were taking like paper applications and emails for a few years there. And when I stepped into this role, I was like, that is very hard to track all of those things. So now everybody needs to go to the website, stonesouppdx.com/applications, or if you go to the website and click our program and scroll down, there'll be a big button in the middle of the page that says fill out application, and that'll automatically enroll you onto the wait list. And that's okay. That's
That is awesome. No, I was just, as you were saying that, I was just looking at your soup subscription.
Mhm.
And so I just popped that in the chat as well. Thanks for the heads up on that, Gabby. And it looks like there's a lot of pickup spots for that as well. So maybe you could talk just a little bit more about that one too, Sam.
Yeah, absolutely. I tend to focus my attention on the program, but we do
Yeah.
have these pretty expansive social ventures. So we were selling our soup at the Wednesday market during this summer. It sounds like we won't be continuing that, but we do have our soups in soup pans right now, and folks can sign up for a monthly subscription. There is a lot of moving and grooving happening in retail right now that I'm not aware of all of the details, but talks of maybe we'll be getting a refrigerated truck and selling in more stores, but everything's kind of in that we're waiting to see where the chips fall with this new space before we jump into the exciting expansion conversations. But yeah, our soups are seasonal. They rotate every 3 months. We try to keep them as local with our ingredients as possible. Our students for a week of the program actually get to join our retail team and go through the start to finish process of making those soups. So exciting things like using a big tilt skillet, or you know, what it looks like to package and deliver, so that they're not just seeing like one aspect of the industry. And yeah, there's more information on the website that is probably in more detail than I can pull off the top of my head.
Awesome. And I have a quick question. So you said it was 5 days a week, correct? The program. What are the hours? And is there any support in trying to access childcare when folks are there, or just kind of what does that all look like?
Yeah, it's Monday through Friday, and in the course of the 12 weeks right now, and this may change as soon as the next month or two, but I'll say right now, the scheduled hours for the first 6 weeks are 9 a.m. to noon. And for the last 6 weeks are 11 a.m. to about 4 or 5 p.m. Right now, we do not have any really extensive options for support with folks when it comes to childcare or really any services outside of job support. It is something that we're, you know, like so many of us are trying to find more resources. We're really more in the camp of connecting people to other folks who might provide resources than trying to house them ourselves right now. But childcare, as we all know, yeah, one of the major barriers for folks who are seeking employment. We have tried to, yeah, just through connection, support people to receive those services, but it's a little tenuous right now.
It is a hard thing. And I'm sorry, I wasn't suggesting that you should all offer it. I just didn't know if you had any connections with partner agencies. And I think that's probably the best way to solve all of these problems, is really collaborate versus trying to all do it ourselves. So, and I don't know, is Michelle still on? She was on earlier with Southeast Works. I don't know if they have, or if any of you have connections to childcare or provide them within your own nonprofit, and maybe have support for Sam and the students that attend. Please feel free to reach out. Collaboration is definitely at the core of what we do and what we support, and definitely what we encourage. So awesome. All right, Sam, thank you so much. Such an incredible program, and it sounds like growing also right now.
Yes.
And expanding, which is always exciting and nerve-wracking, and all the feelings, all the feels.
And
Great.
I'll drop my work email in the chat, and if anybody has any follow-up questions or anything, I'm pretty responsive and super happy to talk more.
That's awesome. Wonderful. Thank you so much. Appreciate you and all that you do. All right. Any questions for any of the presenters? I saw that Sherielyn went in and answered the questions that were stated earlier. Thank you so much for doing that. Any other questions that anyone has for any of our three presenters? Okay. Perfect. Thank you. It looks like all of the emails and information are in the chat now for all three presenters. And apologies then, and that we couldn't hear from the other two, but we're hoping to get them on the slate again on the schedule in the near future. Today's session was definitely focused on health, but in the same regards, I think everything is health, food is health, and our medical connectivity to our medical plans is health. And so, and how we take care of ourselves is health. So it's definitely something that's super important. So thank you for being here. Yes, Sherielyn, you wanted to share a flyer real quick? Sure, you bet.
Yeah, I was trying to upload it in the chat, but didn't see that option. So I'm happy to send it to you if you
Okay,
plan to
yeah,
send
and I can send it out
post-meeting.
afterwards. Yeah, it's a little
Okay.
tricky for some reason, the uploading flyers on the chat. I don't know why.
Yeah. So this is a flyer that we gave out. We had 3 versions of this, just showing different photos of food. We made it in big size font because it was actually your resource fair at the Lloyd. The one that you did with Eco Lloyd was for tailored for 55 and up. So we increased the size fonts. We met a lot of folks there. It was really fabulous. But yeah, if anybody's interested, we can circulate this. It's not on our website yet. When we go out to resource fairs and we table at farmers market for a community booth, we have things like this. That way people in a nutshell know how to find us, where we serve. We did have a struggle with recruiting volunteer drivers during the summer. So for 6 weeks, we paused delivering to the west side, basically west of what is it, the Oregon Zoo, Washington Park. Anything beyond the Multnomah Village, we'd stop delivering, but they were still welcome to request for a meal to come for pickup. What we learned in that 6 weeks of doing that, though, is, one of the main challenges for people to be able to go to pantries, food banks, to soup kitchens, or to go to Milk Crate Kitchen to pick up a meal on a Saturday morning is the lack of transportation, lack of funds. They don't have gas money, they don't have transportation money. They don't have the energy, they don't have the ability to, people with physical disability, or they're on medication, which prevents them from staying awake at like normal times that we would be awake, kind of thing. So it's been a really interesting learning journey of learning more about the communities in need. And that's why we say no questions, no ask. The other flyer I want to share, if I can do it successfully, because sharing screen is always tricky. You know what? I'm not able to share it, so I'm not going to do that. I'll just send it to you, Annie, to send to people. But yeah, it just shows. It shows. Actually, I think I can. Yep, I can right here. If people want to know how far we go, on the left, you see our volunteer names. We cover about 200 miles in 3 hours every Saturday morning. Each color here represents a driver, and the little squares are the number of stops that they make. So if you are interested in getting involved, you would like to help us help others, especially if you are seeing clients, participants, patients, we would love to have you. We optimize routes to save your time and your energy. So if you look to the left, you'll see the drivers, how many stops they make, when they finished, how long it took them, how many miles they covered. So what we do is we try to assign routes based on your ending location, which 90% of the time it's usually where you come from, the neighborhood that you live in. But yeah, somebody made a joke that MCK covers more than TriMet does, and I thought that was funny. And then I stop and I go, wait, that's actually not funny.
Oh,
yeah.
that's a great visual, though.
Yeah, it's speaking of coming together as a community, this is a software that is free up to 10 routes, 10 stops. So if anybody does food box delivery, grocery delivery, you're a nonprofit, maybe you're also small, or you're just going about, maybe you're on a PTA, check out Circuit for Teens. They allow for free routing up to 10 stops. Anything more than that, they require a subscription, but they offer 50% discount to nonprofits. And there's a way to get around what they charge per driver. But yeah, I used to do Google Maps, and I would have 10 browser windows, one per driver. And then I would do spreadsheets so that, you can see these are all, again, these are volunteer drivers. I whited out their names, but, it just gives you an idea of what we did last Saturday, how many meals, how many vegans, how many meat. There was also a way to support remotely. That's what we call comms. So if you ever ordered through Uber and DoorDash and you get those text updates, your driver's almost there. We have real people doing that using Google Voice desktop and using this Circuit for Teams app that I showed you. So yeah, I think it's just like a fun thing that we do, but also comes with labor and real passion. But what's nice is these names that you see here, they've been volunteering with us for a while. Sometimes we don't see them for a year and then they come back. How people learn about us is word of mouth. So it's pretty organic. People share about their experience. So I just want to say thank you for having us and, giving us the opportunity to share about the work we do and the people that we partner with, how we're able to make this happen in the way that we have been.
Awesome. What a cool tool. And we are also a small organization, and technology is our saving grace when it works really well.
Yeah.
And there are times when it doesn't, but it is so beneficial. And we always call it our third person is our technology. So it's valuable or invaluable, I guess would be the word. So thank you so much, Sherielyn. That's awesome. And looks like a lot of people would like to have that flyer. So for all the presenters, any slide decks, flyers, information you want to send to me afterwards, I will post it in a follow-up email as well as a link to the recording. Okay, so we have just about 15 minutes left. I just want to take about 3 minutes, hopefully, to go over the updates for the CSN. We do have a couple events coming up, and I've just posted a link to our website. I know there are some new members on this call, so if this is boring and old news to you, I totally understand if you are wanting to jump off. But for those of you who are somewhat new or maybe haven't been keeping up with what's going on with the CSN, just wanted to take the opportunity to do that. So we have updated our website, and we do have some fairs coming up. We have one actually on Wednesday, tomorrow, with Southeast Works. So it is an employment-focused fair. And you can go to our events page right here and click on Community Resource Fairs. And then you can go to each event. We've kind of changed this a little bit. Click on the event. Obviously, if you wanted to volunteer, you could sign up here. And you can view the table hosts who will be at that event. So this has really been a valuable tool that we've added in the last few months. It takes a few seconds to load our technology on the back end, but then you can kind of see who is tabling at the event. So either if you want to share with a community member who might be wanting to go to the event and they don't know who will be there, or if there's individuals who you want to connect with. I think our events are not only beneficial for community, but beneficial for connecting with each other. So that's something that I just wanted to highlight. And I'm going to go back here. So again, all of these, once you click into it, then you can also sign up to be a table host at the event. So that resource fair is happening on the 18th, which is tomorrow from 11 to 2 at Southeast Works, their new location, which is just a beautiful building. It's incredible. So if you want to like architecture, I would highly encourage you to come check it out. These are our monthly learning sessions, like is happening today. And again, if you'd like to see our upcoming speakers, it'll take just a couple seconds to post, and then you can see all of the upcoming speakers for the next month's sessions. So that's kind of a good way to know if these are a valuable session for you to see. And then our workshops and webinars, these are our Care Oregon HRSN benefit workshops. And then we do have a mental health workshop that's coming up with the city of Portland and Portland Street Response, and then a couple other organizations. So we'll be posting that soon. And then we host our workshops in partnership with YWCA's social justice program here. So those are register workshops. And so you would need to click into there and then register. And finally, we have our Nonprofit Connect, which is happening next Wednesday, October 25th from noon to 4 at the Melody Event Center. If you have not registered and you would like to, I would highly encourage you to do so. You just go to our website and then reserve my spot. Table hosting is full, but we do still have space for guests, but it is filling up. So if you are thinking about it, I would highly encourage you to attend. It's a great networking opportunity to meet with individuals in the community who are serving similar populations, but in a different way, to learn about their programs and offerings and how to access those resources and services. The event is broken into 2 parts. 12 to 1 is a networking and small bites. So if you'd like to come have a little snack, some lunch, and meet with people without being behind tables, that's kind of the first part. And then 1 to 4 is a traditional fair style, but focused on supporting employees of nonprofits, government agencies, and community organizations. So it is not an event that is open to the general public, but teachers, nurses, all of the folks who serve community may attend. Any questions on any of those offerings? Okay, great. Now, does anyone else have anything to share that they would like to share? Any sort of events or anything that's happening that you'd like to share about?
Annie, I just want to make a comment.
Sure.
I just want to thank you for everything that you and sorry, what is her name?
Oh, Ruth. Yes.
Yes, I was like Rachel. No, but it starts
Yeah.
in R.
Very
you guys
close.
have been, yeah, I've been following you since you started, and the improvements you've made, as well as enhancements, how much you've grown, and the way you've sustained it and made it streamlined and easy for us. At least speaking from my perspective, it's been just really great to watch. So for anyone here who is a nonprofit and have not been to any of Annie's community CSN's fairs, I highly encourage doing it. Yeah, we've reached so many nonprofit organizations as well as providers through your resource fair, and yeah, we'll actually be one of the vendors at your Nonprofit Connect, and Christy will be there tabling, and I will be participating in the executive leadership session. So just really looking forward to being in the room with those big brains, like-minded folks. Just, yeah, excited for it.
Awesome. Thank you so much, Sherielyn. Well, it definitely takes all of you doing the work that you do. We get to highlight it and increase the conversation and connectivity between your organizations. So if it wasn't for all of you, we wouldn't be here. So thank you for the work that you do. And thank you so much for that. It's running a startup. There's always new things, new issues to tackle, and we're always trying to streamline what we do, but it's not perfect by any means, but it's definitely been a joy, and so amazing to connect with all of you. So thank you for that. All right, any other highlights to share? Any information? Any events you're hosting? I know we're kind of moving away a little bit from event season. If you do have any holiday events that you know of or that your organizations are hosting, if you could please send me that information. My resource email goes out on Friday. I'd like to have the information by Thursday at noon if possible. That would be fantastic. We are nearing holiday season very quickly. It will be here before we know it. Okay. All right. Quiet house this morning, which is a-okay.
Yeah.
All right. Well, I will let you all get a few minutes back in your morning. If no one has anything else to share, thank you so much for being here. Thank you for sharing time with us, and we hope to see you soon. Have a great day.
Thank you, Annie.
Bye.
Bye, everyone.
Thank you, Annie.